When we think about refractory detrusor overactivity, we don't really understand what the etiology of the condition is. However, some work in our laboratory in 2011 showed that patients with detrusor overactivity were about 4 times more likely to have a urinary tract infection, and this was then followed up with numerous studies that have shown that urinary tract infections are prevalent in about 30 to 50% of patients with refractory detrusor overactivity. We know that a urinary tract infection triggers an inflammatory response, and that inflammatory response is mediated by cytokines, and there's been some small studies that have shown cytokines to be altered in patients with overactive bladder. The aims of this project were to investigate the levels of pro-inflammatory cytokines in patients with detrusor overactivity and in control patients who had no symptoms of urgency. To do this, we collected midstream urine samples from control patients, from patients with newly diagnosed detrusor overactivity and from patients with refractory DO, and then we used an ELISA assay to quantify the levels of the urinary cytokines macrophage chemoattractant protein 1, interleukin 1 alpha and interleukin 6. So the first result was when we collected the MSU specimens, we took a history from the patients and part of the MSU specimen went to the lab for a current UTI analysis. And so the first result was showing that in the refractory DO patients, a current UTI and also a history of UTI was more prevalent. One of the results that we sort of used as a positive control was that the interleukin 6 levels were elevated in UTI, because this has been shown previously in the literature. And when we went on to look at the DO patients, we also found that the interleukin 6 concentrations were elevated in DO patients overall compared to the controls. We were really interested in what was happening with the refractory DOs, so we then subdivided our DOs into newly diagnosed DO and refractory DO, and we found that there were no significant differences in the 3 groups now in terms of interleukin 6 concentrations. But what was interesting was that the interleukin 6 was not detectable in more than half of the control patients, but only in about 10% of the DOs. In terms of interleukin 1 alpha, we found that we had a higher concentration of interleukin 1 alpha in the newly diagnosed DOs compared to the refractory DOs or the controls. And the MCP1 was, the concentrations of MCP1 were similar in all 3 patient groups. So to summarise our findings, the first one was that interleukin 6 was elevated in patients with a current urinary tract infection and also in our DO patients overall, and that interleukin 6 was more likely to be undetectable in control patients. We found that the inflammatory cytokine interleukin 1 alpha was elevated in the newly diagnosed DO patients, perhaps suggesting a greater acute phase cytokine response in these patients compared to the refractory DO patients or the controls. Thank you.
Okay, so we're open to questions. Please, if you come to the mic and tell us who you are and your institution and ask your question. Can I just kick off by saying it's a bit peculiar that you didn't show an elevated level in the recurrent DO group. I think that's the point you're making.
Yeah.
Have you any explanation for that other than it's got burnt out?
We were expecting to see the elevations in the recurrent DO group. What we're actually thinking is that we could have just measured the wrong cytokines. There's so many different cytokines that are released in response to the inflammatory or in the inflammatory response, and we just kind of had to take a guess at which ones could be important. So we could have just measured the wrong ones. In the future, we're planning on doing sort of the cytokine array kit so that we can get a result with a whole heap of different cytokines. But yeah, other than that, we were expecting it to be higher in the refractory DOs, and then the newly diagnosed DOs or the controls should have been the same.
Because there's certainly no doubt there's more infection in the recurrent DO group. And it wasn't just history, it was actually current.
No.
So which cytokine would you elect to measure in the future?
The one that we're going to do next is the interleukin 10, because we're now thinking that it could be something to do with the balance between the pro-inflammatory and the anti-inflammatory cytokines. And interleukin 10 is more of an anti-inflammatory cytokine, so we're thinking that maybe the anti-inflammatory response will be altered rather than the pro-inflammatory response.
Questions from the floor?
I have one question for you. So, in your data, the pro-inflammatory cytokine were elevated in the newly diagnosed DO. So, does that mean there is a undetectable UTI or undetectable bacteriuria in your patients group?
I have another presentation in about 5 presentations' time, and from that I would say yes. Okay. We think that there's a low-level bacteriuria that's happening in patients with DO.